come to the stage. Dr. Rahman, the session is in your hands. Please join us here. I request our guests to join us on the stage as we initiate the discussion. If our honored panelists are here, Mr. Gawher, Nayeem, Wahra, and Dr. Mohsin Ali, please join us on the stage.
It's okay. Do you want to be in the middle? No, it's okay.
Thank you.
Good afternoon. Assalamu alaikum. This is actually the very fag end of our conference, ICCTASS 2025. Perhaps we have almost drained out our energy level, but still, what we are going to discuss about actually related to energy is energy for body and energy for health. And the title of this panel discussion, Leveraging Sustainable Development on Synergies of Health and Socio-Economic Discourses. I am Dr. Sabuktagin Rahman, Senior Associate Professor, Department of Public Health, American International University. Welcome you all to attend this important session. I'm a public health researcher. So when I analyze the health data, I found there is a clear link with poverty. It is inevitable. For example, when we found that people eat lots of rice, they do not eat other varieties of nutritious food. Why? Because they cannot afford them. And the people who are eating lots of rice are more likely to get diabetes. Now, this diabetes is a disease, you all aware of this disease, diabetes. It is a household name, the diabetes. The diabetes is such a disease that it actually leads to other kind of complications. From here, we can find high level of blood pressure, heart disease, and even it affects the brain. So what we found, actually, people's health, their socio-economic status are not actually, you cannot separate them. They exist together. So with this note, to discuss more about this connection, we have with us our honorable and respected panel members. To my next, Mr. Gawher Nayeem Wahra, a seasoned development practitioner for over 4 decades. I started working with him perhaps about 25 years back at Save the Children UK. He's a faculty member, former faculty member at University of Dhaka. He's a champion in disaster management. We used to say him Durjog Nayeem in our earlier days. With me, we have another respected public health professional with tons of experience in public health over the last 4 decades, and he has been instrumental to develop and redesign the health and nutrition policy of Bangladesh, none other than Dr. Mohsin Ali. So thank you very much for attending this session. We are really we are really benefited that we have got you to talk about this very important topic. So I would go back to first Dr. Nayeem Wahra, sir. First of all, I would like to give a very short bio of Mr. Wahra. Over 40 years of experience in managing development agencies, as well as developing, monitoring, coordinating social sector program at local, regional, and national and international level, with a focus on climate and disaster management. Mr. Wahra worked with disaster risk reduction and climate change adaptation program at different humanitarian organizations such as Oxfam, CARE, ActionAid, Save the Children, Plan, Swiss Development Cooperation, and UNICEF. He has experiences working in Kurdistan, India, Myanmar, Nepal, Pakistan, Somalia, with specific assignment on disaster risk reduction and humanitarian response. So my question, Mr. Wahra, we see that there is an effect of change of climate. I mean, we can see the coastal districts getting salinity is a problem in the coastal districts. We can see there's a change pattern in weathers. Now we see the duration of summer is long and it is very hot and humid. But winter is very short and it is still warm. We can see a prolonged duration of rainy season. And there is untimely incidences of storms, cyclones, and there are some incidences of flash floods in the northeastern part of the country. So how do you perceive that these changes in climate is affecting the lives, the livelihoods, and most importantly, health of our population?
আমার কথা কি আপনারা সবাই শুনতে পাচ্ছেন? উনি অনেক লম্বা করে আমার পরিচয় দিয়েছে। এখন মজা হলো যে হাটের ভিতরে দুইজন রাত্রে আটকায় গেছে, বাড়ি যেতে পারছে না। তো একজন কোন বাড়িতে আশ্রয় নেবে? পরে বলছে তুই আমাকে হাজী সাহেব বলবি, আমি তোকে মৌলভী সাহেব বলবো। তাহলে আমাদের খুব বাড়বে সমাজে, তারা হয়তো কেউ জায়গা দিবে আর কি। এগুলো মানে কোনো কথা না, কে কতটা কোথায় কি কাজ করছে। কথা হচ্ছে যে আমরা আমাদের কাজে কতটুকু বিশ্বাস করি। আপনাদের ভিতর থেকে কোনো প্রশ্ন আছে নাকি? আমাকে একটা প্রশ্ন দিয়েছে, সেটার উত্তর আমি দিব। আপনাদের কোনো প্রশ্ন আছে নাকি? যে কোনো প্রশ্ন করতে পারেন। নো কোশ্চেন ইজ স্টুপিড কোশ্চেন। প্লিজ, প্রশ্ন নাই? আচ্ছা, তাহলে আমি বলি। আমি প্রথমে ওনার সাথে একটু দ্বিমত করব, সাবুক্তাগিন সাহেবের সাথে। উনি যেটা বললেন যে প্রভার্টির কারণেই মানুষ তার নিউট্রিশনের ঘাটতি হচ্ছে। কথাটা হয়তো একদিক দিয়ে ঠিক, কিন্তু পুরাটা ঠিক না। পুরোটা ঠিক না এই কারণে যে আমাদের অনেক জিনিস আছে যেটা আমরা আমাদের ছেলেমেয়েদের আমরা পিৎজা খাওয়াচ্ছি কেন? কেন তাদেরকে ফাস্টফুড দিচ্ছি? আমি কি গরিব মানুষ? হ্যাঁ, গরিব বলে কি খাওয়ায় এগুলা? কি বলেন আপনারা? তাহলে কেন খাওয়ায়? হ্যাঁ, স্ট্যান্ডার্ড হওয়ার জন্য, বা ধরেন আমার ঝামেলা কমে গেল, কিনা খাবার দিলাম, সেটা হতে পারে। এটা একটা জিনিস। আরেকটা জিনিস হচ্ছে যে আমরা যত আধুনিক হচ্ছে, আমাদের পুরনো যে অভ্যাসগুলো ছিল সেগুলোকে আমরা খারাপ বলে মনে করছি। আমাদের দেশে যে চৈত্র সংক্রান্তি হয়, এটা বাঙালিদের একটা অনুষ্ঠান। চৈত্র সংক্রান্তির দিনে একটা জিনিস দেখবেন যে গ্রামে এখনও হয় কোথাও কোথাও, এটা একটা এনভায়রনমেন্টাল অডিট। তারা বাড়ির আশেপাশ থেকে 12 রকমের শাক রান্না করে। ওই দিন কোনো আমিষ হয় না, শাক মানে সবজি দিয়ে রান্না হয়, এবং এটা বাড়ির আশেপাশের 12টা বা 13টা সবজি তাদের নিয়ে আসতে হবে। তখন একটা এনভায়রনমেন্টাল অডিট হয়ে যায় যে আমার কোনটা হারিয়ে গেছে, যেটা গত বছরে ছিল এবছরে নাই। এই যে জ্ঞানটা, এই জ্ঞানটা তো আমরা ইগনোর করছি। আমাদের নিউট্রিশন এটা কমে যাওয়ার পিছনে এটাও একটা বড় কারণ, যে আমরা লোকাল যে নলেজ ছিল আমাদের, সেই নলেজগুলোকে আমাদের স্বাস্থ্যের জন্য কিছু ছিল, আবহাওয়ার জন্য কিছু ছিল, আমাদের বেঁচে থাকার জন্য কিছু ছিল, সেগুলোকে আমরা পুরনো বলে এমনভাবে ইগনোর করছি যে আমরা আবার নতুনভাবে নিচ্ছি, আমরা পিৎজা, তারপরে ফাস্টফুড এগুলা নিচ্ছি। ফলে সমস্যা প্রভার্টি ছাড়াও অন্য জায়গাতে আছে, খুব ব্যাপকভাবে আছে। সেটা আমাদের একটু মাথার মধ্যে আনতে হবে। আরেকটা জিনিস যেটা আমরা খুব কেয়ারলেস, আর কি হবে, ডায়াবেটিস হয়েছে, একটা মিষ্টি খেয়েছে, দুটো মিষ্টি খেয়ে বলছে চায় কিন্তু চিনি দেবেন না, আমার ডায়াবেটিস আছে, করেন এরকম? তো এইগুলো আমাদের একটা বড় সমস্যায় ফেলছে। তারপর মূল প্রশ্নে যায়, যেটা উনি বলছিলেন যে এই আমাদের বেড়ে গেছে, স্যালাইনিটি বাড়ছে। স্যালাইনিটি একটা মজার কথা হলো, আমরা যতবার বলবো যে ক্লাইমেট চেঞ্জের কারণে স্যালাইনিটি বাড়ছে, ততবার কিন্তু আমরা আমাদের মূল সমস্যাটাকে সরিয়ে দিচ্ছি। আমাদের মূল সমস্যা হচ্ছে আমাদের সুন্দরবন অঞ্চলে বা অঞ্চলে, যেটা সাগরের কাছে যে অঞ্চল, তার মূল মিষ্টি পানির স্রোতধারা হচ্ছে পদ্মা। আমাদের পদ্মার পানির হিস্সা আমরা পাচ্ছি না, এইটা আমাদের মূল সমস্যা। তারপরেও পদ্মা পেলেও আমরা পদ্মা নদী থেকে কমপক্ষে 6টা জায়গা থেকে পানি উঠিয়ে নিচ্ছি ডোমেস্টিক পারপাসে। শুধু রাজশাহী শহরেই পানি উঠায় প্রায় প্রতিদিন কয়েক হাজার কোটি লিটার। তারপর ঢাকা শহরের পানির জন্য নেওয়া হচ্ছে পদ্মা থেকে, খুলনা শহর নিচ্ছে পদ্মা থেকে। এত কিছু নেওয়ার পরে সুন্দরবন পর্যন্ত পদ্মার পানি বা গড়াইয়ের পানি পৌঁছানোর আর পানি থাকে না। তো সেটা আমাদের নদীগুলোকে আমরা কীভাবে ম্যানেজ করছি, স্যালাইনিটি বাড়ার সাথে সাথে এটাও একটা সম্পর্ক। তার মানে এই না যে ক্লাইমেট চেঞ্জের কারণে হচ্ছে না, এটা অবশ্যই হচ্ছে, সেটা একটা জিনিস। কিন্তু সেই সাথে আচ্ছা, সেইটা একটা কারণ যে we are not managing our rivers properly, we are not taking care of our share of the river from our neighbor countries. এটাও একটা বড় কারণ। There is other reason that we are also taking out the water from the river and we never consult the river when we are managing the river. নদীও একটা পক্ষ, কিন্তু আমি যখন when we are negotiating with the river sharing with the neighboring country, nobody represents the river. River has a right to go to the sea. প্রেমিকার যেমন প্রেমিকের সাথে দেখা করার অধিকার আছে, নদীরও তেমন অধিকার আছে টু সি দ্য সি রিভার। সেটা আমরা কোনো সময় বলি না। নদীর তো কিছু পানি দরকার, আমার সেচের জন্য আমি নিচ্ছি, ফর মাই ইরিগেশন আই এম টেকিং আউট অফ দ্য রিভার সাম। আবার আরেকটা বড় সমস্যা হবে আমাদের পদ্মা নদীর পানি, আমরা নিউক্লিয়ার যাচ্ছি, পাকশির পাশেই পদ্মা নদী, ওখান থেকেও পানি তোলা হবে। নিউক্লিয়ার প্ল্যান্টে তো প্রচুর পানি লাগে, আপনারা জানেন। সো সামবডি শুড রিয়েলি রিপ্রেজেন্ট দ্য রিভার। আমাদের হাইকোর্টের একটা ডিসিশন আছে যে নদীকে একটা জীবন্ত সত্তা হিসেবে কাউন্ট করা। রিভার ইজ এ লিভিং ক্রিয়েচার অ্যান্ড রিভার শুড বি ট্রিটেড অ্যাজ পার্ট অফ দ্য টোটাল নেগোসিয়েশনস। সেটা আমরা করছি না, ফলে আমাদের একটা সমস্যা হচ্ছে। নাও কাম ব্যাক টু দ্য পাবলিক হেলথ ইস্যুস। আমাদের এখন বড় একটা সমস্যা হচ্ছে, যেহেতু স্যালাইনিটি ইজ রাইজিং ইন দ্য কোস্টাল এরিয়াস, কোস্টাল এরিয়া থেকে কিন্তু আমাদের কলেরা এবং ডায়রিয়া মুছানো খুব কঠিন হয়ে যাচ্ছে। স্যালাইন ওয়াটারে এটা কিন্তু এই কলেরার যে জীবাণু আছে এগুলো সাস্টেন করার সুযোগ পায়। তো আমরা যখন রোগী বাড়ছে, উই আর ট্রিটিং দ্য পেশেন্ট বাট নট দ্য রিয়েল কজ। সেটা একটা বড় সমস্যা আমাদের। আর আমরা হি অলসো মেনশন অ্যাবাউট দ্য হট ওয়েদার, আমাদের বেড়ে যাচ্ছে, উত্তাপ বাড়ছে, তার কারণ তো আমাদের এই বিল্ডিংগুলাই। এখন ঢাকা শহরে ইফ ইউ গো টু দ্য সিটি ইউ ক্যান সি লট অফ হাউসেস আর কামিং আউট উইথ দ্য গ্লাস। তো এখানে তো আপনার অনেক, এগুলোকে ঠান্ডা করার জন্য যেমন আমাদের লাগে, আমাদের অনেক খরচ হচ্ছে। সেই সাথে আমাদের আপনার বাড়িটা যদি ওরকম থাকে এবং পাশে যদি অন্য আরেকটা বাড়ি থাকে, তো সে আপনার গরমটা তার বেশি লাগবে। নট অনলি ইন দ্য ঢাকা সিটি বাট অলসো ইন দ্য আদার টাউনশিপস। we are going for such a building construction which is really not very helpful for the for people to live in. Apart from that, we are also extracting our water from the ground level. If you go to any township, now there is a new concept of extracting water from the ground. They call it submersible pumping system. And anybody can buy it and anybody can install it. There is no regulation. The only thing you have to give the municipality some money, then you can do it. You can extract any amount of water from the ground. So the person who is living with a tube well now no water is there to use for them. So বড় পাম্প যখন বসছে তখন ছোট হ্যান্ড পাম্পগুলো অকেজ হয়ে যাচ্ছে। এটা একটা বড় জিনিস আমাদের রেগুলেটেড হচ্ছে না। আমাদের আসলে মেইন ইস্যু হচ্ছে গভর্নেন্স ইস্যু, সেখানে একটা সমস্যা আমাদের আছে। আমরা ইয়েস ইরাটিক রেইন হচ্ছে, রেইনের কিন্তু আবার যদি আপনি দেখেন যে রেইনের পরিমাণটা কত, সেটা কিন্তু বছরের গড় হিসাবে ঠিকই আছে। শুধু যেটা হচ্ছে না সেটা হচ্ছে যে সময়টা আমি এক্সপেক্ট করছি সেই সময় হচ্ছে না, অন্য সময় হচ্ছে। কোন সময় শরৎকালে অটাম সিজনে উই আর ফেসিং লট অফ রেইন বাট নট ইন দ্য রেইনি সিজন, সেটা একটা সমস্যা। বাট দ্যাট ক্যান অলসো বি ট্যাকেল বাই ম্যানেজিং দ্য রেইন ওয়াটার। আমরা রেইন ওয়াটার হারভেস্টিং কিছুই করি না। আমাদের এই বিল্ডিংয়ের যতটা ইয়েতে আছে, উপরে যে ছাদ আছে, এই ছাদের যদি পানিটা আমরা সব রাখতে পারতাম তাহলে কমপক্ষে 6 থেকে 7 মাস কোনো পানি আমাদের নিচে থেকে উঠাতে হতো না। এটা সহজ হিসাব, এটা অঙ্কের হিসাবের মধ্যে পাওয়া যায়। কিন্তু আমরা সেই পথে আমরা হাঁটছি না। উই আর নট ইউজিং দ্য রেইন ওয়াটার ইন এ ওয়ে সো দ্যাট ইট ক্যান গো ব্যাক টু দ্য গ্রাউন্ড। অ্যান্ড ওইটা একটা বড় সমস্যা হচ্ছে, আমাদের গ্রাউন্ডের পানি কমে যাচ্ছে দিন দিন। এবং কোথাও কোথাও জায়গায় আপনি দেখবেন যে ইফ ইউ ডিগ ইন ইভেন 1000 feet, there is nothing. Everything has become the sand-like soil. So this is the situation of our ground. তো আমাদের ভূমিকম্প লাগবে না, এমনি এক সময় এটা it's happened in Indonesia. All on a sudden 10 building collapse. There was no earthquake, nothing else, because the ground extraction of the water from the ground that caused a big vacuum in the ground, and then all on a sudden that's happened. That can always happen to Dhaka also. So আমাদের এটাও একটা হিসাবের মধ্যে আনতে হবে। পৃথিবীতে কোনো কিছুই বেহিসাব নাই, সব কিছুই হিসাবের মধ্যে, কিন্তু আমরা বেশি বেহিসাবি হয়ে যাচ্ছি, সেটা একটা আমাদের বড় সমস্যা। আমাদের যতটুকু লাগে তার চেয়ে বেশি আমরা খরচ করি, এটা পানিতেও করি, সব জায়গাতেও করি। এবং এইখানে যদি ইফ উই ক্যান restricted the misuse of the water, the misuse of the other things, then a lot of problem could be solved very easily. আমি এখানেই থামবো, কারণ আমার পাশে আরেকজন জ্ঞানী মানুষ আছেন, ওনার কাছ থেকে আপনারা শুনবেন। তো আমি এই পর্যন্ত যা বললাম, এখান থেকে কোনো প্রশ্ন যদি আপনাদের আসে আপনারা জিজ্ঞাসা করতে পারেন, বলতে পারেন। আর সবুক্তগিন সাহেবও যদি মনে করেন কোনো প্রশ্ন আছে, he can also ask. Thank you.
Okay, I would like to just summarize some key points from Mr. Wahra's talks. He has given some different perspectives about the link between health and nutrition and poverty. There are some cultural aspects, like, in Bangladesh, there are some foods that is readily available in our rural settings, but we do not appreciate them. We think that these are the foods for poor. So, and these, trust me, these foods are very rich in nutrients. So, I mean, that is another aspect that we should consider. It's not only about just, we don't have income, so we don't have earnings, and we don't have enough access to good food. The food that is, he is referring that pizza, which is called a prestigious food. It's not that. The pizza or the ultra-processed food, these are actually not very nutritious and healthy food. So this is another issue that he has actually tried to focus on. We have to be mindful about the cultural context. And the second thing, he has identified a clear link between a rising salinity level in the coastal districts and its connection with some infectious disease like cholera. That is very important. And in another aspect, he identified that the cause of the rising temperature, especially in the urban settings in the country, is the faulty construction of buildings. I mean, the buildings are constructed without sufficient spaces between them, and the heat is actually getting trapped inside between the buildings, and that is one of the reasons that we feel very hot. The cities are very hot. The other thing that is, I think, is kind of very thought-provoking. This is the very high level of extraction of groundwater. I mean, the rural people of Bangladesh, they are actually extracting their water, the potable water from tube well, you know, and this is groundwater. And what happens when we extract these groundwater at an excessive level? These level of water, the water table gets down. So what happens? I mean, the soil over the water level, they lacks any support. So what happens? Actually, we are heading towards a situation, then we might be susceptible to earthquake. The damage due to earthquake can be greater because the level of water is getting down. So, I mean, I think we will come back later to Mr. Wahra. And now I'd like to talk our second panelist, Dr. Mohsin Ali. Before I pose my first question, I'll give a short bio of Dr. Ali. Dr. Mohsin Ali is a public health and nutrition specialist with 4 decades of experience working in National Health and Nutrition Services of Bangladesh. Dr. Ali has intensive engagement at national policy, strategy, and plan formulation on health and nutrition. Currently has been working as an independent consultant with assignments on diverse disciplines, including nutrition program development, evaluation, advocacy for nutrition, capacity development and training for nutrition, and most importantly, multi-sectoral nutritional policies. First of all, Dr. Ali, I would like to ask you, you know, or we all know, food and nutrition are fundamentals to health. But nowadays, we have seen there is a shift in our societal landscapes. For example, and you know, there is a change in the dietary pattern, and it might be due to the rapid urbanization, or it might be the influence of the Western culture, or it might be some, you know, the technological breakthroughs at the food industries. So how do you perceive that these shifts in the societal changes is affecting the dietary habits, nutritional status, and most importantly, the health of this population?
Thank you, Dr. Sabuktagin. Assalamu alaikum, and good afternoon. And my learned another panelist, Mr. Wahra, and audiences. Actually, Dr. Sabuktagin, he is my, what is called, I am not a faculty member. I am an actually development activist, working for a long time in the government and then United UN organization, and currently as an independent consultant. So by education, I am a public health specialist, as a medical graduate, and by work, I really worked in the different government programs. And later stage of my service, I worked at the policy level, policy strategy formulation. So the question that has been put to me, is very interesting. In the last session, we see how colonization and so many things we have, and Western civilization. Really, in terms of health and nutrition, the question has raised whether Western civilization or some culture, that Western culture and rapid urbanization, sometimes is called it is the sequence of development. How it is affecting nutrition and health? It's a very interesting question. And it's a paradox also. Sometimes what we call development is not really development. It is actually sometimes complicating the whole scenario. For example, in this part of subcontinent, if we see our traditional diet and how it has been changed. Our traditional, Mr. Wahra also referred to some point that we are very fond of vegetables. Yes, our traditional diet included, may not be now, mostly rice, fish, pulse, and vegetables, and to some extent fruits. It was a traditional diet. And now the latest knowledge actually acknowledging that this is the most healthy diet. In the meantime, we have lost we lost some momentum. We abandoned this and we are moving to some very unhealthy diets. And why it is happening? It is due to some urbanization, some lifestyle change. So now the nutritional problem and health problem, now it is called disease of civilization. Rhetorically, although it is rhetorically called, it is disease of civilization, sometimes disease of lifestyle, and also a consequence of urbanization. And a recent nationally representative survey in Bangladesh that adolescents of our population, they are eating what is called fast food, that is different kind of snacks, then beverages, say sugar-sweetened beverages, every day, more than 7 times in a week. And mostly boys, and 60% boys and 50% girls. They are taking what is called fast food every day, even more than 7 times in a week. And what they are really mostly they are educated. They are from the wealthy families. At the same time, not only adolescent, adult diet behavior has also been changed. We are moving now, particularly the urban population, is moving to more calorie-rich food. Calorie, but nutrient less, with nutrition, less nutrition. Why? Our major food is rice. And what as rice, where we eating? Mostly polished rice, not whole grain. It is not whole grain, it is polished in the automated factories. So, and also you are taking so many fast food. Where they are being prepared, it is in the industry, at the industry level. So technology also has created some problem. So all these actually, our dietary habit has been dramatically changed over the time. Now what is the consequence of this? What is the problem of this? Now we can see another survey in 2025. It is telling that 50% of our adult women population are either overweight or obese. Also the adult girls, adolescent girls, 15% of them are either overweight or obese. It is the consequence of the wrong diet. It is the consequence of the fast food. So many fast food, so many amount as well as quantities of fast food you are taking, it is really creating a huge problem of overweight and obesity. And obesity is the mother of all disease. That what is we are calling the non-communicable diseases. Dr. Sabuktagin has referred to diabetes. 10% of the Bangladeshi adult population are now have diabetes. It's a huge burden. We can't imagine. It is overall development and economic consequence is really, and social consequence is really, it's a havoc. 20% of our population, adult population, are suffering from hypertension, high blood pressure. 20% of the population. So, and mostly women and obese. Among the obese, this population, the hypertension prevalence is just doubled. And also, we heard of some cancers. You can heard so many high prevalence of cancers today. These are all consequences of the wrong dietary habit. To some extent, majority extent, it is wrong dietary habit of a fast food and wrong food. What does wrong food means? It is refined carbohydrate. We are not taking the whole grain. We are moving from vegetable and fruits and pulses towards other food, which are calorie rich but nutrition, lack of nutrition. It is called problem of civilization or problem of urbanization, problem of lifestyle change. And it is actually how it is harming us. In Bangladesh, the whole health service is not overloaded with non-communicable diseases, blood pressure, diabetes, and some cancers. The whole system cannot bear the load of this huge problem, and the days are coming ahead will be further disastrous because our health system cannot manage so many. 10% Bangladesh population is 180 million. And can you imagine about 30% of them are suffering from non-curable lifelong disease. That is hypertension, diabetes. So the load we are on the, say, not only government system, but also the individual pocket. And in Bangladesh, out-of-pocket expenditure for health is one of the highest in the world. It is about 70%. So this is actually pushing people to the below the poverty line. Millions of people are being pushed below the poverty line due to this huge disease burden. Another problem is that now our population, that is the mortality, annual mortality, people are due to non-communicable diseases. 70% of the adult mortality is due to non-communicable disease. So it's a huge burden to the society, huge burden to the national exchequer, as well as development issue. And our productivity is being hampered due to huge obesity, huge disease burden. Another aspect is that it is about double burden of nutrition. I think you have heard of this terminology, double burden of malnutrition. That is undernutrition and overnutrition. It is happening at the same time, in the same family, in the same community. So far I have actually, what I have told you, it is the consequence of overnutrition, that is overweight, obesity, and non-communicable disease. But also undernutrition is prevailing in our poor communities. And it is another problem. So it's a huge also. Still in Bangladesh, although globally overnutrition has surpassed undernutrition, but in Bangladesh, undernutrition is the major problem still, but overnutrition is rapidly actually crossing it. And very soon we will be seeing that our overnutrition surpassed the undernutrition. And undernutrition actually, the most vulnerable population, the poor, they are actually suffering from it, and it is also hampering our development. You know that our mothers are giving birth to low birth weight babies. And these low birth weight babies, they are due to mother's undernutrition. And when these low birth weight babies will be grown up, and when they will be adult, they will be mostly suffer from non-communicable disease. So it's a vicious cycle that is actually attacking our whole population. And we have to get rid of it. Otherwise, our total development effort will be jeopardized due to this what is called nutrition as well as health disaster. And this burden, actually it is not emphasized in our, we are mostly busy with some mitigation of disasters and others. But when we are telling about development, we are not so much giving emphasis on the human development. And nutrition, you know, we all often told that education and health is the pillar of human development. But nutrition is the foundation of health and education. How? Because nutrition determines the cognition capacity of how he will be learning, how he will be getting education. That depends on the nutritional status. And it is determined in mother's womb. Our brain development mostly happens in the mother's womb. And undernutrition of mothers actually interfere with the brain development. So it's a huge problem. And our next issue will be how to face both undernutrition and overnutrition simultaneously. And it is a critical trade-off. If we like to address the undernutrition, we can actually contribute to the overnutrition. So it is a very critical trade-off. And so for our human capital development, we must emphasize nutrition as well as health and education. Otherwise, as a nation, we cannot progress. So I will be stopping at this point. And if I get the next chance, I will tell something about how to overcome this, how to actually really face this challenge. Thank you.
Thank you. So at this point, I would like to request our learned audience, do you have any question to our panel members? Yes.
I have observed that young generations, they are becoming taller than us. That means the average height of Bangladeshis are increasing. Is it an effect of nutrition or effect of steroid? Thank you.
Steroid, I'm not sure. This is the first time I heard of it, that is the impact of steroid. No, actually, one of the nutrition indicator is stunting. That is low height with relation to age. And we usually measure it in the under 5 children, not in the adult population. Anyhow, in under 5 child, the nutrition, that is stunting, is reducing. But I cannot see any statistics about the height of the what you call adolescent population. Yes, it may happen, no doubt. As the under 5 stunting is reducing, we can expect that it is actually transferring to the adolescent population, average height. But you know, in Bangladesh, 1 in 4 child under 5 is still stunted. Stunted mid Bangla jake boli amra khato, khorbo. Apparently, height of the adolescent has been increased. But as we are seeing, no doubt, it is an effect of development, it is happening. But if we compare with the total population, it is not a significant change. We are seeing the people in the surrounding you. But actually, when you measure the population, then the percentage will not be so high. Secondly, if you count by number, because in Bangladesh, 1% means lakhs of population or million. If you count by number, so now currently we actually do it, count by number, not by proportion. Then the number will be huge. So it is not totally correct that, yes, some partial improvement is there, and you have observed rightly that we can see some people who are a bit high in height. But overall national situation is still not so good, because 1 in 4 child is still under average height. We have no statistics about the adolescent or the adult population. Anyhow, we can assume that, yes, as the stunting is reducing consistently over time in Bangladesh, yes, it has some effect on adolescent as well as adult height. But still, if we consider it and on the total population basis, it is not so much really good. But sustainably and consistently, it is reducing. I don't know whether I will be, I have answered your question, but yes, your assumption is correct. But if you calculate it very quantitatively and meticulously at the population level, it may not be correct.
Assalamu alaikum.
Yes,
I'm
please.
Shaila. I have listened to your talk, and what I have understood that the total nutrition as well as the land collapses that we are observing nowadays is the outcome of too much dependence on the Western food as well as Western water irrigation. So in my talk as well, I have talked how the education system in Bangladesh is collapsing because of the too much dependence on the global north. So from the government's perspective, is there any way of indigenizing the water irrigation and other aspects? Is there any steps taken by the government to fight back this impositions of the Western machineries in our landscape and fighting back this disaster that we are observing in our environment? Thank you.
Thank you for the question. Very good question. I think, yes, academically, theoretically, policy level, we are doing that, no doubt. Because now, planetary health diet, it is not a global issue. And now agriculture, food production is really judging against the climate. And our agricultural current food system and food, what is called agriculture system, it is now also not climate friendly. So yes, now government at the policy level, government is trying to make the what is called good agriculture practice. Yes, it is in the policy level. We cannot take it on the ground so far. But good practice means efficient and scientific use of land, scientific use of insecticide, scientific use of fertilizer, everything. Also diversification of the crop. We are so much rice dependent. We are the highest rice eater in the world. But it is not healthy really. And to some extent NCD or non-communicable disease is related with. But we are now crop diversification. Government has policy to that, and they are trying to do more production of, say, pulses, vegetables, fruits. And if we cannot actually switch from rice dependency to those actually pulses, fruits, vegetables, we cannot get nutrition. So at the policy level, it is there. And this is also happening on the ground. But to see the result, we have to wait. And also we have to struggle more. But it is happening. Also another way, government is also trying to change the dietary habit of the population through education. Through education, that is what is called formal education as well as informally, through communication. Say very recently, government has national dietary guideline, what this the ideal diet should be. And the issue is that we are actually very rapidly, we are moving towards the negative side. Not so good in the positive side. Because our traditional diet was good, not bad. We used to, although we are a more rice eater, but we used to take fish, we used to take pulses and vegetables. It's a tradition of this area, say, what is called Bengal. It is the traditional Bengal diet. And now the now people are telling, yes, it is the healthy diet. But actually we are moving apart from that. We are moving away from that. That is the disaster. That is the problem. So we are facing so much non-communicable diseases. It is the consequence of that. So much overweight and so much obesity. And obesity is the mother of all NCD, I told you that. So the problem is very complex. At the same time, we are also suffering from undernutrition. And to cover up the undernutrition, we are creating some problem. That is the overnutrition. That is the very critical trade-off between undernutrition and overnutrition. Thank you.
Sorry, actually we have running out of time. It is about 15 minutes over. So we have to conclude this session. I welcome our Chair, Board of Trustees, Nadia Madam. We missed you. We started the occasion about 50 minutes back, but we'd like to engage you further later. I just want to thank the audience for, holding your energy till the end, and thank you very much for participation and some active, very good questions. And last but not the least, I must thank our distinguished panel members once again for your time and for your valuable advices to address this very important public health issues and development issues in Bangladesh. So with this note, I am concluding and I'm signing off. Thank you very much.
Thank you, Dr. Rahman, and thank you to all our distinguished panelists for this engaging discussion. I would request Dr. Rahman and our panelists to stay on the stage for just a little moment because, ladies and gentlemen, we are deeply honored to have our chief guest, Ms. Nadia Anwar, the respected chairman of the Board of Trustees, American International University, Bangladesh, with us. Please welcome her with a round of applause. Madam, would you join us here on the stage to share a moment of appreciation for our panelists? Ladies and gentlemen, we have our chairman, honorable chairman here with us. Now, we will be distributing. I would request our chair to share a plaque of appreciation. I would also request our Provisor, sir, Dr. Abdul Rahman, sir, and Dr. Tajul Islam, sir, to join us here because this is going to be a special moment. So the first token of appreciation goes to Mr. Gawher Nayeem Wahra. I would request our madam to share, to hand it over to our esteemed panelist. Thank you. The next token of appreciation goes to Dr. Mohsin Ali, Health and Nutrition Policy Analyst and writer. And finally, last but not the least, Dr. Sabuktagin Rahman. Oh, Dr. Mohsin Ali, yes. So Dr. Sabuktagin Rahman, thank you for your efforts to make this session very lively. I request our panelists and Dr. Rahman to take their seats among the audience. Our honorable chair and our pro vice chancellor, may I request you to please stay with us. Please do not go, we need you. Please stay here on the stage and please take. Dean sir, I would request you to stay here with us for the next very, very weighted session. I think we are all waiting for this moment. So this is the final segment of the International Conference on Contemporary Trends in Applied Sciences and Sustainability, ICCTASS 2025. And we have our award-giving session, which is going to start very soon, but let us hear a few words of inspiration, first of all, from our Pro Vice Chancellor, Dr. Abdul Rahman. So, sir, I would request you to please take the podium. Thank you.
Well, thank you very much, Honorable Chairman, Board of Trustees, and the Chief Guest for today's conference closing session, Mrs. Nadia Anwar, and the founder member of AAB as well, Honorable Dean Sir, the conference chair, respected registrar, the teachers, my dear teachers, distinguished guests, participants. So I hope that you enjoyed the last 2 days of activities, engaging activities, I would say. So we started it yesterday morning, and it was like hectic schedule. And as the title says, that we talked about the trends, and I really thank the conference organizers for arranging the papers and the keynote speeches, like covering all the social science and multidisciplinary topics. So I believe that the discussions, the presentations, and the keynote speeches all helped you to open your mind about new resources, think about the new resources, and then, in fact, talk to each other. In the conference, it is not only the knowledge, you know that. We expect that people will be collaborating with the new colleagues, and like-minded people who are working on the same topic should be coming under one umbrella and bring something new. So that will determine the success of the conference, and that is, we have been doing it with all our faculties, and this time we are doing it with the first. In fact, within next 1 year, we are having 3. Next May, we will be having from our business faculty. Then in September, we will be having from the computer science, the science and technology faculty. And in next 27 January, we have the engineering one. So it's actually on row, and many will be coming. Many will be coming there. And it is, we really thank the AAB management, our Board of Trustees, and the administration for all the supports they give us, monetary as well as the guidance, all the everything. And the topic you can see that is the sustainability. So, and after that is creativity and ethics is given. Without ethics, nothing sustains. So ethics is very important. We believe that should be our takeaway from here. We need to be ethical. We need an ethical future, and we need to have ethical generation who will be practicing ethics, not only talking. They will be practicing. They will be committed to the ethics. That is what actually we want, and that is what from AIUB for any such kind of support, for any such kind of activities, we will be always together. We will try to help, and we will be leading forward as well as following the people who follows that. So we believe that this conference, you find it very successful, and we will take away from here whatever we learned here and practice it in our real life. So thank you to the organizers, thank you to the Faculty of Arts and Social Science, and everybody involved for such a wonderful last 2 days conference. Thank you very much.
I request our Madam Chairman, Ms. Nadia Anwar, to give a closing speech for the conference.
অ্যাকচুয়ালি যখন এই ধরনের কোনো ইভেন্টে আসে আমি নিজে একটু প্যানিক অবস্থাতে থাকি, মানে অ্যামং সো মেনি নলেজেবল পিপল অ্যান্ড হু নোজ সো মাচ, অ্যান্ড লাইক আই সে দ্যাট এভরি ডে ইজ আ প্রসেস, আ লার্নিং, উই ক্যান লার্ন এভরি ডে, অ্যান্ড ইনফ্যাক্ট আই এম লার্নিং ফ্রম অল অফ ইউ ইচ অ্যান্ড এভরি ডে। সো সবার সামনে এসে যখন বলতে হয় কোনো কিছু, আই রিয়েলি প্যানিক আ লট। আর যেটা আমাদের প্রভিসি বললেন, actually AIB management, from the management, I would say that we always appreciate anything like this kind of events, not only this kind of events, what we feel that something that our students can learn from, jeta oder jonno bhalo hobe, and we are always into that. So I have a short speech, and I'm sure apnara shobai bore hoben na. Already you've been hearing so many nice things and good things, but I will read it quick. Ladies and gentlemen, respected scholars, distinguished guests, and dear participants, Assalamu alaikum. As we bring international conference on challenges and trends in art and social science, ICCTASS 2026, to a close, I stand before you with a deep sense of pride and gratitude. This conference has been more than an academic gathering. It has been a meeting of minds, cultures, and ideas. Together, we have explored the evolving challenges and emerging trends that continue to shape the fields of art and social science in profound ways. Your insights have reminded us that these disciplines are not just academic pursuit. They are the heart of our humanity. They help us to understand societies, bridge divides, nurture creativity, and build empathy. In a world that is rapidly transforming, politically, technologically, and socially, the work you do has never been more important. Your insights have reminded us that no, okay. I would like to extend my heartfelt appreciation to our esteemed speakers, researchers, moderators, and participants who enrich this conference with their knowledge and passion. My sincere thanks to the organizing committee whose dedication and hard work has made ICCTASS 2026 a resounding success. As we conclude, I encourage each of you to carry forward the conversations we started here. Let the collaborations formed today turn into research that inspires, policies that empower, and ideas that uplift communities across the world. On behalf of Board of Trustees, I thank you all, and we meet again with new discoveries, new perspectives, and renewed purposes. Thank you so much.
Thank you, Madam Chairman, for that inspiring message and for your continued vision for AIUB and this conference. We now proceed to the moment we are all waiting for, the award distribution ceremony, where we will recognize the best papers and outstanding contributions in ICCTASS 2025. So I will call the name of the papers that are selected as the best, and I will also ask the presenters who are actually present here to come to the stage and receive their recognition. So from track 1, Economics, unveiling the drivers of NPLs, Bithi Rani Aich, Muhammad Tanveer Islam, Sanjay Banerjee. There are 3 presenters of this paper. I believe one of them is present with us. So the presenter who is present is going to receive the recognition on behalf of his members. Let us move on to the next special recognition from English Literature, track 2.1, Tarnum Fatima Chaudhary, John Paul Shimanto, Nasra Sharafuddin, Yasir Arafat. I would request the representative member to be here on stage. From track 2.2. Okay, sure.
My heart is beating so fast. This is my place, AIUB. I am an alumni of this institution. And I'm so privileged as well as nostalgic today. And I would like to give credit to my co-authors, along with the living legend, Professor Dr. Shaila Sultana, who encouraged us to go for such collaborative work, for which actually we could do such in-depth study. And we are already done with that, but I really appreciate for what you have done and how you have encouraged, madam. Thank you so much. Thank you, sir.
Thank you. For the next track, 2.2 English language, we have Ashikur Rahman Shorov, Muhammad Shifat Ahmed. I believe one of them or both of them are here. Could you join us quickly on the stage? And we'd like to mention that our sponsor, they are giving a gift certificate of worth 3,000 taka for each of our awardees. We have our sponsor, Bata, who is offering us a Gift certificate of worth 3,000 for each awardee. Next, we have track 3, which is law. Rafi Ahmed, if you're here, please join us on the stage. Rafi Ahmed. Okay, so the head of the Department of Law, I would request Dr. Firdaus to come here and receive it on Rafi Ahmed's behalf. Thank you. For track 4 MMC, we have Dr. Shahzadi Zamurad Awan. If you're here, can you join us on the stage? Shahzadi, oh, this was, okay. I think she is not here. I believe we will make sure that she receives her award. From track 5, Public Health, Dr. Sabuktagin Rahman. Can you please join us on the stage once again? And finally, from track 6, Social Science, Marzia Rahman, Muhammad Muhaiminul Islam Niloy. If you're present, please be here on the stage. Okay, so once again, the head of the Department of Social Science, Dr. Buddhadev Vishwash, will receive it on behalf. So these were the on-site paper presentations, but we also have some poster presentations, and the recipients for the poster presentations from Track 5 Public Health, Nihila Nazmul from Khulna University. Can you join us here on the stage, please? From Track 4, we also have Shumit Paul, and I guess he will be representing his team, Mesbauddin Bhuiya, Kothik Chandra Bhomik, Muhammad Murad Hassan, Muhammad Murtuza Ahmed. So Nihila is presenting for her solo, is receiving the honor for her solo presentation, followed by Shumit Paul. Shumit and his team, please join us on the stage. And finally, from Track 5, also Public Health, Hassan Shahriar Samiul, Muhammad Alfazuddin, Qazi Fardin Rahman Riyad, and Muhammad Shafayat Hussain Shamim. If you are present, please join us here on the stage. All these are from American International University. Only Nahila Nazmul is from Khulna University. So this is a great moment for us. Thank you. Thank you, all the award recipients. And I would like to mention our sponsors who actually have helped us organize this wonderful event. So our platinum sponsors were CF Moto. I believe there is a representative from that organization here with us. Can you please join us on the stage? We have Eastern Bank Limited and SMC as our platinum sponsors. So I guess the representative from CF Moto, he's here with us. CF Moto have helped us organize this wonderful event. This is our token of appreciation to them. Are the representatives of Eastern Bank here? EBL Bank. And finally, we have SMC. Is any member from SMC here with us? Dr. Niaz Mazumdar is going to receive the crest on behalf of SMC. I would request our Professor Niaz Mazumdar sir to join us on the stage. So the final platinum sponsor, SMC, Professor Niaz Mazumdar will receive on behalf of SMC. Kunjo Global Edu and Travel, they were our gold sponsor. I believe a member representing them is here. Our gold sponsor, Kunjo Global Edu and Travel, is receiving a token of appreciation. Next, we have our silver sponsors, Bata, Clemon, Jamuna Bank, and Mahindra. I believe a member from Mahindra is here, so I would request the representative to be here on the stage. We would also like to honor our chief guest who is present with us with a token of appreciation from Faculty of Arts and Social Science. Our chief guest, Nadia Anwar Madam, is receiving from our general chair of the conference, our Dean Professor Dr. Tajul Islam. Thank you, distinguished guests, for your presence and encouraging us. Now I request, we finally have come to the vote of thanks. We invite Dr. Faria Sultana, the organizing secretary for ICCTASS 2025 and associate professor in the Department of Economics, to offer the final formal gratitude. Thank you.
Thank you, sir. Honorable Chief Guests, distinguished keynote speakers, respected faculty members, eminent researchers, delegates from home and abroad, students, ladies and gentlemen, a very good afternoon. We came to the very end of this international conference. As we come to the close of ICCTASS 2025, it is my great pleasure and privilege and honor as the organizing secretary to deliver this vote of thanks. Over the past 2 days, we have engaged in meaningful discussions, exchanged valuable ideas, and reflected deeply on the theme that we have selected for this conference: sustainability, creativity, and ethics, insights into interdisciplinary perspectives and practices. First and foremost, we extend our sincere gratitude to our chief guest for the closing ceremony, for gracing the occasion and sharing insightful reflection that enriched the conference among all of her important involvement. Our heartfelt appreciation goes to our keynote speakers for their thoughtful, provoking, and inspiring presentations. One of them is present here. Thank you, madam. Your contributions have truly elevated the quality of discourse throughout these sessions. We also express our sincere thanks to all session chairs, session organizers, moderators, and paper presenters. Your scholarly work, engagement, and dedication have been central to the success of ICCTASS 2025. A very special note of gratitude goes to the AIUB management, whose visionary leadership and consistent support made this conference possible. We deeply appreciate the role played by the administration of AIUB, starting from all the offices, from the proctor's office to all the supporting offices that we have at AIUB. We are equally grateful, as I said, to the supporting staff of AIUB who work tirelessly, often behind the scenes, to manage logistics, technical arrangements, and everything that we need for this particular conference. We extend our appreciation to our executive committee members, to our international and national delegates. My sincere thanks to the organizing committee members, volunteers, technical team for your passion, teamwork, and commitment. Without your hard work, ICCTASS 2025 wouldn't have been achieved the success we celebrate today. We are grateful to our sponsors and partners. We had 3 co-organizers, universities from Malaysia and Indonesia, for their support and trust in this initiative. I'd like to extend my great appreciation to all the participants and attendees. Without even presenting the papers, they were here with us in these last 2 days. As we conclude, it is my great honor and pleasure that Faculty of Arts and Social Sciences, each and every member of the faculty, along with the other faculties at AIUB, has worked extremely hard among all the commitments that we usually have to make this ICCTASS 2025 a success. Thank you very much from me and on behalf of the organizing committee. As we conclude, may the discussions, insights shared over these 2 days inspire continued collaboration, innovation, and ethical practice in our academic and professional lives. Thank you once again. I wish you a pleasant evening ahead. Thank you very much. The last announcement for this conference: tea is served outside the auditorium. Please do have your tea before you leave the campus. And a little announcement for poster presenters. We can also have a group photo. May I have your attention? We can have a group photo with all of them who are present here. Please come forward for a group photo. I request everyone to please stay back for a couple of minutes for a group photo. Volunteers, can you please call the participants who left the auditorium?
Recording stopped.